The CoCreating Welfare project, a project funded by Erasmus+. It's a European project. We're working with partners in Denmark, France and Portugal, with the overarching leads in the South Denmark office between Denmark and Brussels. The idea behind this project was to develop and work with people to find out what the needs are for co-creation, what people do know, what they want to know, what tools they need. And then we've gone on to create a course, a training course, and pilot it with the people.
I've sort of done co-design, co-production stuff in the past, so I thought it would sort of build on that. I just found my mind was sort of blown apart, really. It was 4 days of experiential learning, so we co-created together. So that was how I grasped the concept by doing it.
We've worked with a whole range of people. It originally started in the UK with NHS England, with Macmillan Cancer Support, with University Hospitals Coventry and Warwickshire, and the Cardiac Rehabilitation Unit, and also Birmingham South Clinical Commissioning Group. And we were talking to them, and then as the projects evolved, we had more and more people come on the course. So that include other areas like physios and midwives and other professionals, but also people working in education and teachers and lecturers as well. As a result of that, it's been really taken up by some key groups. So NHS England have really thrived. We've co-designed a slightly different version of the course with them. And we've then trained people in NHS England with Always events, which is about always doing co-creation as part of a philosophy. It should always be an event. And with the National Maternity Voice partnerships as well.
Our culture in the NHS a number of years ago was very much doing 2 people and 4 people, and now we're moving to doing with, and that's a very different skill set, and hosting those conversations. I don't think co-creation is difficult, but it's just having the confidence to host that space really and invite people to join the conversation, co-create with you.
I have come to talk about the co-creation that we're doing across maternity. We have a fantastic network of over 100 maternity voice partnerships, which are local groups of women and families, midwives, obstetricians and commissioners who sit together regularly to review the local maternity service and co-create it. When you think about women and their partners having babies, if they can be involved in how services are shaped before they then use them, or as a result of having used them, they're much more likely to find those services easy to access, feel like they own them, feel comfortable with how they're provided if they choose to have a baby next time round.
I've come along today to learn more about co-creation. I'm also presenting some of the work that I've been doing, giving us an insight into how we can embed some of these methods and some of the tools that we've been talking about. It's so important to get the voices of the people that your services may affect, or people that may be using your services, to make sure that they are fit for purpose and that they meet the needs of those people that are actually going to be using them. It's very difficult for a team of academics to sit around the table and write a course that is going to meet the needs of the students, of the employers. It's really important to get their voice.
I'm actually here today representing something called the Collaborative Poetics Network, which was set up by Helen Johnson in Brighton. I've been using co-creation for about 10 years already, so I'm very invested in it. I'm particularly interested in disability and inclusivity in co-creation, and I think that the co-creative techniques that are used can free up people from all walks of life with all kinds of disabilities. I think it's important to hear everyone's experience, and only in that way can I produce things to help people that are truly going to help them.
The UCL Centre for Co-Production in Health Research is a project that we're co-producing. It will be a centre to support co-creation and co-production in research. So my role is kind of coordinating the development of that centre with a big group of patients, of members of the local community, of carers, of researchers, of healthcare practitioners. You hear from a diverse set of people, and actually their views are part of decision making, rather than perhaps one group of similar people making decisions. Don't be tied down by kind of, we've always done it this way, or you must do a certain thing. Be creative and do whatever it is you want as a group. So together you can produce something amazing.
I'm Engagement and Empowerment Project Manager at NEL-CSU, which is an NHS Commissioning Support Unit. It means we work with lots of different health organisations in supporting some of their work. And the reason that I came along today is to do a presentation about some of the work that I've been doing and how I use participatory appraisal in co-design. So participatory appraisal is a qualitative approach to community research, really. It's about empowering and working with people as peer researchers to go into their own communities and find out insights about what matters to them. It's a really effective way of finding out what people think, how people feel about things, and I think it's a really important part of co-design. So essentially when we're doing co-design, we're not just asking people and doing that initial research, but we're actually doing it with them, and that research is done by them.
If you get the right group of people in the same space, you can get consensus on what's actually needed, you can understand what's actually needed, and the solutions that you eventually reach will be more appropriate and more effective. And these kind of habits, these kind of techniques are very easy to adopt, so I think the hope would be that these just carry on. You use them in your workplace, you use them wherever you need to. And that those techniques also evolve. They're not rigid, they're not set in stone, they constantly change. So I think it would be amazing just to see them developing.